Hello everyone and welcome back to our channel. Today we're diving into an important topic in healthcare, the SSA RO antibody test. If you're new here, don't forget to hit the subscribe button and ring the bell to stay updated on all our latest videos. Now let's get started. Pre-test information. Before we delve into the specifics of the SSA RO antibody test, let's talk about some important pre-test information. If you're scheduled for this test, it's recommended to fast overnight. This means refraining from consuming any food or drink for a set period before the test. Fasting helps ensure accurate results, so be sure to follow your healthcare provider's instructions closely. Specification of test. Now let's discuss the specifications of the SSA RO antibody test. This test is designed to detect antibodies associated with a specific antigen called SSA RO. These antibodies are often found in patients with autoimmune conditions such as Sjogren syndrome, lupus erythematosus, and rheumatoid arthritis. Disease-associated. The SSA RO antibody test is particularly relevant for evaluating patients with signs and symptoms of connective tissue disorders. In fact, it's estimated that approximately 90% of patients with Sjogren syndrome and 40–60% of those with lupus erythematosus and rheumatoid arthritis may test positive for SSA RO antibodies. Specimen used. So, what specimen is used for this test? Typically, a blood sample is collected from the patient. This sample is then sent to a laboratory for analysis. Components include. Now, let's break down the components of the SSA RO antibody test. The test kit includes reagents and materials necessary for detecting SSA RO antibodies in the blood sample. These components work together to provide accurate and reliable results. Test report time. One question many patients have is, how long does it take to receive the test results? Well, the test report time can vary depending on the laboratory's workload and other factors. However, in most cases, you can expect to receive your results within a few days to a week after the sample is collected. Test information. In summary, the SSA RO antibody test is a valuable tool for evaluating patients with suspected connective tissue disorders. By detecting SSA RO antibodies in the blood, healthcare providers can make informed decisions about diagnosis and treatment. Remember, if you have any questions or concerns about this test, don't hesitate to reach out to your healthcare provider. Benefits of early detection. Early detection of autoimmune conditions such as Sjogren syndrome, lupus erythematosus, and rheumatoid arthritis can significantly impact patient outcomes. With the SSA RO antibody test, healthcare providers can identify these conditions in their early stages, allowing for prompt intervention and management. Implications of test results. It's important to understand the implications of test results. A positive result for SSA RO antibodies doesn't necessarily mean a definitive diagnosis of a specific autoimmune condition. It indicates the presence of these antibodies, which may warrant further evaluation and follow-up testing by your healthcare provider. Before undergoing the SSA RO antibody test, patients should be aware of any medications or supplements they're taking, as certain medications can affect test results. Medical history or symptoms to your healthcare provider to ensure accurate interpretation of the test results. That's all for today's video. We hope you found this information helpful. If you did, please give this video a thumbs up and share it with your friends. And as always, thank you for watching. We'll see you next time.